I think right now the closed system devices, or CSTDs, are probably the most protective piece of equipment that we have, without yet really being able to quantify exactly what the risks might be. But as Dr. Polovich talks about in her work, we just don't know when accidental exposure can occur, and a closed system may or may not be helpful, but it's just one additional piece of protection. And it's any of the brand names of the closed system devices, whether it's, EquiShield's product or Facile's product or any of the others that are mentioned or that we have available, it's just another layer of protection. It's very hard to quantify when you need it and when you don't. First of all, because you don't know when accidents might occur or accidental exposure can happen. So I think that's what they do, and I think the question oftentimes becomes is how much protection is enough? If there is exposure, and we're not always clear that there is, how much protection do we need? And would you be willing to say you can use this level or this level, and which do you choose? It's sort of like seat belts. You don't need seat belts unless you're in an accident. But when you do get in an accident, you're grateful to have that level of protection. So I think this is a similar thing. It gets confusing because no entity yet has mandated that level of protection, or when they must be used. All the statements right now say they're preferable but not required, or some language to that effect. So it's very unclear, and I think some cases the language is, for lack of a better word, kind of mushy, that doesn't really make clear what we should do. And so institutions or where nurses work, or where there is nurse exposure, are allowed to follow or not follow any kind of guideline other than the really strict ones that are regulatory. And the position statement or position is not a regulatory piece. It's merely advice that people can choose to use or to ignore.